Thank you so much for being here this afternoon. I'm very grateful, particularly to our physicians and medical personnel that are joining us on this important press conference. Dr. Ladapo is our topic, Florida's new Surgeon General. He's only been on the job for 2 short months, but it took him no time to make clear that his appointment to the office of Surgeon General was a political appointment aimed at, above all, serving Governor DeSantis and his political agenda, not the people of Florida. It took Dr. Ladapo just 1 day after being appointed to issue an emergency rule in stark contrast to all the guidance being issued by the CDC that allows COVID positive kids back to the classroom, effectively endangering the lives of their fellow students and teachers. Let me give you one personal example. I have a 5-year-old niece that lives in Pinellas County, Florida, where I live, one of the counties that did not defy Governor DeSantis and did not issue a requirement that people wear masks in the classroom. So she goes to class. They started about 3 weeks ago. A few days thereafter, she contracts COVID, 5 years old. She obviously goes home in the evening. She has a 2-month-old sister, my 2-month-old niece, who about 10 days ago contracted COVID herself. These things are happening all over the state of Florida, and they don't have to be happening. And it is tragic that they are. So let me continue. It took the doctor 1 day to disregard the cries of teachers, school staff, parents, and immunocompromised students who all begged for common sense safety precautions so we could start our school year off safely instead of the way it started in Pinellas County for my 2 nieces and many others across our state. And from that moment to today, Dr. Ladapo has made it clear that he was appointed not to help our state battle this public health crisis, but to be an ill-informed political tool for the governor of Florida. From being unwilling to share his own vaccination status, to claiming that the usage of masks is overrated when it comes to curbing the spread of COVID, to now most recently displaying a blatant lack of respect for Senator Tina Polsky and her recent medical diagnosis by refusing to wear a mask when coming to her office when she's now been diagnosed with breast cancer. Ladies and gentlemen, the writing is on the wall. Dr. Ladapo has proven himself time and time again to be unwilling and truly unfit to hold such a high office at a time when our state needs true medically sound leadership. Dr. Ladapo claims he thinks it's quote unquote fun to reason with unreasonable people. Unreasonable people being folks who apparently believe in science, social distancing, and mask wearing. Dr. Ladapo, nothing is fun about this pandemic we've been living through, with hundreds of thousands of Americans' lives lost, about 60,000 of our fellow Floridians who are now dead. That is more Americans than died in the war in Vietnam. And that's from one state, our state of Florida. What's most important is getting our state and nation out of this pandemic without any more lives needlessly lost to this virus. It is clear that Governor DeSantis only sought to feed his own political interest when he appointed Dr. Ladapo to the office of Surgeon General. And it's equally clear that Dr. Ladapo is not of the moral character and professionalism needed in order to best serve our fellow Floridians. Not only should Dr. Ladapo not be confirmed by the Florida Senate, I am calling on Governor Ron DeSantis to pull back this nomination. If he refuses to do that, then Dr. Ladapo himself should resign. With that, I'll turn it over to Dr. Jeff Berman. Thank you and God bless you. Doctor, you may have to unmute.
Thank you, Governor. You summarized that very well. I'm Dr. Jeff Berman. I'm a pulmonologist, critical care physician, practicing in Florida for 35 years. I have a very strong background in public health. The job of a Surgeon General of the state of Florida is really threefold. One, to be in charge and oversee the Florida Department of Health, also to set public policy, health policy, for all Floridians in consultation with various physician groups such as Florida Medical Association, other health organizations and healthcare professionals, and to advise the governor. But most importantly, setting policy. Now, Dr. Ladapo's background, and a Surgeon General should have public health experience, without question. Now, his background is in cardiology. He has absolutely no public health experience. But even worse, since this pandemic began, he has totally downplayed the pandemic in terms of opposing any mask mandates, opposing vaccines, downplaying the efficacy of vaccines. He promoted hydrochloroquine and ivermectin, totally unproven drugs. In addition, as a cardiologist, he's promoting hydrochloroquine, which has cardiac side effects. He's going against any guidelines from the CDC, any physician organization, any national organization, and totally opposing any sort of science-based evidence medicine, which is really what we go by as physicians. Florida physicians the past year and a half have advocated for a more proactive science-based stance and strategies against this pandemic, which has killed at least over 700,000 Americans and about at least 57,000 Floridians. And this physician is not taking any of it seriously. I mean, the best example was last week at Senator Polsky's office. And there's been so much backlash in the newspapers about his lack of qualifications, the way he's acting flippant, not wearing a mask. He is just not qualified in any way, shape, or form to be the Surgeon General of the state of Florida. He just should resign and hopefully will not be confirmed. I honestly, and the unfortunate part really is that I really truly believe he believes what he's saying, which is totally against any science, evidence-based guidelines. And this is a physician who went to Harvard Medical School. So it just, again, and this is not just since he took this job, this goes back to the beginning of the pandemic, involved with groups like this American Frontline Doctors, and, again, promoting, unproven medications such as, again, ivermectin and hydrochloroquine. Again, I, as a physician in Florida with background in this area, I strongly hope that he resigns or is not confirmed by the state Senate. Thank you very much. And Dr. Schillinger.
Doctor, I think you need to unmute.
Oh, they muted me. They muted me when I wasn't looking there. Okay, thank you very much. One moment. So I'm Dr. Brent Schillinger. I'm past president of Palm Beach County Medical Society, former chair of the Council on Ethical and Judicial Affairs for both Palm Beach County Medical and the Florida Medical Association. As I look at this situation, I am concerned. I think there are a lot of ethical concerns. Forget about the fact that Dr. Ladapo has no expertise in public health, as we've established, no expertise in epidemiology, no expertise in virology, no expertise in infectious disease. Putting that aside, look at all the other unethical or questionably ethical activities just recently. As it came out the last day, he won't share his vaccine status. Apparently, he was kind of secretly fast-tracked to a University of Florida appointment. We know the story from last week where he wouldn't put on a mask when he was in Senator Polsky's office. Obviously, he didn't care about her health. How will he care about the health of 20 million Floridians? And I'm curious, when he goes to visit the governor and his wife, who was recently diagnosed with breast cancer, if Governor DeSantis will ask him to put on a mask and what will happen in that circumstance. Just curious. So public health, you have to realize, is about dealing with population health. It's not just an individual, but it's how the whole population functions. The first day, this guy, as you heard, issued an emergency rule forbidding mask mandates in the school. I mean, come on, mandates are nothing new, even though he makes it sound like this is a horrible, horrible thing. Mandates are a really critical part of public health for the public good. In the words of my mentor, Dr. Ken Goodman, who heads bioethics down at University of Miami, Ken says, look, in terms of mandates, we have mandates. We have well-accepted mandates. You are not allowed to drive while you're drunk. You're not allowed to throw oil in the well. You're not supposed to hit your kids with sticks. Florida, basically, after this appointment, has become a laughingstock in the public health arena. This guy is supposed to be a leading medical expert. I'm not quite so sure. I can tell you that my colleagues on all levels are embarrassed. Even doctors who work for the state of Florida, who are pretty much silenced about saying anything, are rolling their eyes. I have one colleague who has a high volunteer position. He sent me an email the day that this appointment was made. He says, who could have been worse than this guy? Well, we came up with a few, perhaps some of Dr. Lapado's esteemed friends from the America's Frontline doctors, Stella Emanuel. She's the one with the demon semen, says miscarriages come from having sex in your dreams with demons. And if she can't make it, perhaps Sherry Tenpenny from Ohio. She's the one who says that the COVID vaccines make you magnetic. At any rate, you heard about the Committee to Protect Health Care, which Jeff referenced. They have a letter where over 150 Florida doctors have signed on, calling on the state Senate to ask some very serious questions when it comes to the confirmation hearings. You hear the request for resignation. Any real chance of a resignation? I'm not so sure. Governor DeSantis has already said he's not going to back down on his appointment. So my pragmatic message here is that the people of Florida need to remember who made this appointment. If this is the kind of leadership, public health leadership that you're comfortable with, keep that in mind when you go to the polls next year. On the other hand, if you're concerned or disturbed, reflect that in your vote. Vote your conscience in 2022. Up next, joining us fresh from the operating room, I'm told, our colleague, Dr. Linda Green. Welcome, Linda.
And Linda, you need to unmute also.
Thank you. I apologize.
Sorry.
Good morning, and thank you for this platform on which to advocate for right and not political decisions. We really need to protect our children. We need to protect each other. We need to care for others in our decisions. Unfortunately, that's not being done by our leadership. I'm an OBGYN in Coral Springs, literally just delivered a baby, so I apologize for just stepping in. And unfortunately, I see pregnant women not being able to go home with their children, never being able to go home with their little babies. I see pregnant women coming to my office 6 weeks postpartum, they're having been on a ventilator, still having oxygen. And we need to be protecting all of our citizens with rules and regulations that are considering the least of us, not the strongest of us, and not doing things out of our ego, but because of concern for each other as citizens of our great America. And I just hope that we can stand up and not allow people who are not having those considerations, not, oh shoot. I'm sorry, I don't know what happened.
We can hear you. It's okay.
Oh, good. Not continue to have a platform upon which to stand. Thank you for your time.
Thank you, Doc.
Mhm.
Well, listen, I just want to thank all three of you physicians for joining us this afternoon. Your insight and your keen sense of integrity and professionalism on this important issue is most appreciated. So Dr. Schillinger, Dr. Berman, Dr. Green, thank each and every one of you. And now we will open it up to see if our friends in the press have any questions of you or me.
Thank you, Congressman Crist. If you, members of the media, if you have any questions, please feel free to send us a message in the chat box, and a member from our team will call upon you to unmute yourself and ask Congressman Crist and the panelists any questions. We have Evan Donovan, sir. Evan, you can go ahead and unmute yourself, and please go ahead and ask the congressman and panelists any question you have.
Great, thank you guys very much. I guess it's a two-part question here, one for the doctors and one for Representative Crist. The people who oppose wearing masks point to a lack of great high-quality data, they refer to it, randomly controlled trials showing that, masks in school settings actually do work to reduce the transmission of
If I can interrupt
COVID-19.
for just a second, and I'm sorry. I think somebody is still unmuted and we're getting some feedback. Go ahead, Evan. I think we got it corrected.
Okay. Yeah, so again, just the people who oppose masking say that there's no high quality data from which normal scientific interventions decisions are made, with where you have randomly controlled trials and they show that the masking in schools reduces transmission. That's their claim. So I suppose there's a first question to the doctors on this call of, is there anything to that? Do you know of great data supporting that masking absolutely works and that we should be using it, particularly in these indoor settings? And then secondly, for you, Representative Crist, is this even as much about the masking itself and the data and the science around masking, or is this more of, in your mind, just about general respect for people who are our peers in the world of politics?
Doctors, you want to handle the first part of that question from Evan?
Sure. Let me address. There is no, double-blinded placebo studies on masks per se. However, viruses, in particular, this virus is extremely transmissible. The Delta variant, even more so. It's a respiratory virus, and wearing masks, certainly are do cut down on transmission. K95 mask, which really is the most secure, certain, but any face covering, in my mind, will cut down on respiratory transmission. Just an anecdotal story. We didn't hear too much this past winter about the flu and people getting the flu as we normally do because people were wearing masks. But this virus is very transmissible, and so again, there is no scientific data yet, but in my mind, masks are critical, indoors especially.
There has
Can I
been a
make
great...
one comment?
Go ahead.
I was just going to say that we're taking something that is a public health issue and making it political. So in that case, we can let whoever's making those decisions also deliver your baby and take care of your hypertension. So we are making our best efforts at giving the best, making the best decisions to advise our communities. So if you trust us to care for you and keep you alive and keep you healthy, why are you taking the decisions that are public health decisions and making them in the political arena?
And there's clearly a great deal of anecdotal evidence, and there has been a number of studies showing that from a physical perspective, the masks will cut down tremendously on the transmission. Studies done right here at FAU in Boca Raton last year documenting exactly how much fewer transmissions there will be for people who are wearing the mask. So we have no doubt in our minds that this is a positive thing to do.
And Evan, if you could...
Okay, I add one more statement. Virus, and it's a respiratory pathogen, and any face covering will help reduce transmission. You know, the virus will attach to a respiratory droplet, and you know, when somebody speaks, studies have shown that when you go 6 feet or more, the droplet will go with the virus, and you know, and it's easy to inhale, and it's certainly a mask will help, social distancing, and most certainly vaccines. And it's unfortunate how politicized this all has become.
Yeah, Evan, if you could repeat the part of the question that you directed at me, I'd be grateful.
Absolutely. Representative Crist, I just wanted to ask, sort of in your mind, is this issue really about the science and data of masks, or is it more about just having respect for someone? For instance, if I was to come to your office and you said, hey, you know, I like people to take their shoes off in my office, regardless of what your request was, I'm in your space. I think there are a lot of people who have looked at this scenario and thought, there's something beyond just science and data and masks here.
Oh, you mean with respect to his visiting the state senator's office?
Correct, yes.
Sure. I mean, yeah, obviously. Listen, you know, it is science-based, no question about it. It is healthcare-based. We're talking about a state senator who has been diagnosed with breast cancer. And we're talking about a surgeon general that doesn't at least wear a mask. So I think it's both, Evan. I really do. It is science and healthcare related, but it also is common decency related. And it is indecent of the Surgeon General or the nominated Surgeon General of Florida to not comply with a simple request of this state senator when he's in her office there apparently to be interviewed so she can make a decision about whether he's worthy of her vote to be formally nominated by the state Senate. I mean, that's outrageous human behavior. It's not practicing the golden rule, doing unto others as you would have done unto you. So he's unfit on that score, and he's unfit from the healthcare score because most conventional wisdom in this area has been expressed by these 3 great physicians that we have on the call today. And the one person that the governor decides to nominate to do this is one of these people who doesn't understand the science of what's happening here and doesn't appreciate it, nor does he respect it. And so that's why I think, number one, Governor DeSantis should withdraw the nomination for the benefit of the people of Florida, because this guy has proven himself unfit. If the governor's unwilling to do the right thing, then the doctor should do the right thing and resign his nomination. You know, if that doesn't happen, the state Senate at a minimum should not confirm the nomination. He's unfit on all fronts.
Thank you, Congressman Crist. Our next question is from Ann from Florida Politics. Ann, please feel free to unmute yourself.
Hello, thank you for taking my question. We've heard a lot about his sterling credentials. How do you, as medical professionals, reconcile, you know, what is coming from his mouth with those sterling credentials?
Well, there are plenty of people who went to Harvard and worked at UCLA and had some appointments and are eloquent who are also crazy. So I think just because you have those couple of credentials under your belt does not make you a credible expert. And if you notice, UCLA has already taken him off of their website and tried to distance themselves. And I imagine there's a lot of heads rolling at UF at this point as well.
Can I follow up, please? Are you saying that you think he's crazy?
I said you could be, okay? You could be, you know, there are people who are, just because on paper you have great credentials, it doesn't necessarily mean that you have the top expertise. And the credentials that this doctor has are credentials, but they're not, as we've stated repeatedly, it's not a credential in public health and epidemiology and virology in the areas that someone who runs the Department of Health and is considered the health expert for the public health in the state of Florida should have.
if I could just add another comment, I really truly believe that he believes what he's saying. And, there are other physicians, as we've seen, this group, American Frontline Physicians, other physicians that, have promoted these, unproven and or disproven medications or herd immunity. Even though this physician went to Harvard and, I'm sure he's well educated, but this is not his area of expertise. Certainly is not. And the way he's acting, he certainly doesn't seem to care. There was an interesting article that Randy Schultz wrote that says, it was talking about Governor DeSantis, and it was about a week or so ago. And he goes, he just doesn't care. And that's what this physician, he just doesn't care about the health of the citizens of Florida. If that's how he acted to Senator Polsky last week, how is he going to act to all the other Floridians in setting policy?
Thank you, Doctor. Our next question here is from Lawrence with the Tampa Bay Times. Lawrence, please feel free to unmute yourself.
Thanks. My question is for the doctors. Dr. Ladapo said that he didn't wear a mask in the meeting with the senator because it prevents him from communicating clearly and effectively with people. I'm just curious what you made of that.
Well, I think that's a bogus excuse. I mean, I've been wearing masks in the office for the last year and a half, and 95 masks, no less. And I have no problem communicating with my patients. Would you prefer your surgeons not to be wearing masks so they can communicate better with you while they're operating on you?
Certainly, there's no problem communicating with a mask. I mean, we've been doing it for the last year and a half, and that was just to say a BS answer by that doctor.
Okay, and we've got one more question coming in here from NBC6. Please go ahead and unmute yourself.
Hello there, and thank you for the opportunity. This is Marissa Bagg with NBC6 down in Miami. I have a question really for anybody who wants to answer, but I certainly want to hear from Representative Crist. There were reports that State Senator Tina Polsky had taken other meetings that same day and been photographed not wearing a mask. And she had even been quoted in other reporting that, yes, she hasn't necessarily been consistent in following the mask policy herself, but that when it, comes to her office, that's a different issue. But, how do you respond when people are pointing out that she's not necessarily maybe holding everybody to the same standard when it comes to mask wearing?
Well, Marissa, we're talking about someone who's been nominated to be the Surgeon General of the state of Florida. There's only one of those. And that's who we're talking about today. And that person should be held to the highest standard. This is somebody who's chosen, one would think. I mean, I used to appoint people as governor too. And you want to have the best and the brightest that have common sense and decency about them as well. And so the real question is why the physician, the nominated Surgeon General, would not have worn a mask in the office of a state senator who informed him that she was medically compromised. I don't think she gave him the full diagnosis of her breast cancer at the time, but she was medically compromised, and simply as a courtesy and as a healthcare issue, asked him to wear a mask while in her presence, and he refused. Unconscionable. That's remarkable. That's the point here. If she wears or doesn't wear a mask in other environments where she may feel safe because she's at a distance or whatever it is, that's her decision to make. But when someone comes into the confines of her own office, and I don't know exactly what the diameter is of the room that she's in with him, it may have been less than 6 feet with him sitting across her desk. But why not adhere to the simple, decent request to wear a mask in her presence when she knows she's medically compromised, and shared that information with the nominated Surgeon General of the third largest state in the country?
and should be sitting in a room with a gentleman who does not wear masks, who we have no idea of his vaccine status, and we know people who are, certainly people who are not vaccinated, people who don't wear masks, who are in various environments, at the very least may be carriers of the virus, a much higher percentage. So it's reasonable to have that concern in this situation.
And why would we point the finger at her? Why would we point the finger at her as opposed to looking at his actions? I'm not quite sure why we're concentrating on her actions. I think we should be concentrating on his actions.
Yeah, she wasn't nominated to be the Surgeon General of our state.
Yeah, just from a medical point of view, people who are vaccinated, with people who are vaccinated, the risk of the rate of transmission is lower because there's less of a viral load to transmit. So, when you're vaccinated with another vaccinated person, social distancing, wearing a mask, the risk of transmission, even not wearing a mask in an open area, the risk of transmission is much lower than somebody who's unvaccinated. And I don't believe this doctor gave his vaccination status, and I suspect, I'm just speculating that he's probably not vaccinated.